In this podcast episode, Kelsi Sheren discusses the increasingly controversial subject of assisted dying, exploring its rapid expansion in Canada and other parts of the world. She delves into the ethical, medical, societal, and financial dimensions of medical assistance in dying, MAID, expressing concerns about coercion, vulnerable populations, and the monetization of death. The conversation touches on parallels with eugenics, the shift in eligibility criteria, and the broader cultural implications of normalizing death. Kelsi asserts that assisted dying systems function as modern eugenics programs, targeting individuals deemed burdens on society, such as those with disabilities, mental illnesses, and the elderly. She argues that these programs systematically push for the elimination of difficult individuals under the guise of dignity and choice. By framing certain lives as costly or inconvenient, the system encourages the deaths of people who might otherwise receive care or support, leading to ethical and moral concerns reminiscent of historic atrocities. The episode outlines how countries like Canada, the Netherlands, and Belgium have progressively expanded euthanasia laws, including allowing the killing of minors and people with mental illness. Canada's MAID legislation began intensively after a Supreme Court ruling in 2015 and has evolved to include people not facing terminal illness, contrary to the original intention. Kelsi highlights distinctions between physician-assisted suicide and euthanasia, explaining that Canada predominantly practices euthanasia, where doctors administer lethal drugs directly. Kelsi provides insight into the MAID process, describing how doctors and nurse practitioners carry out psychological and medical evaluations over often brief sessions to deem if a patient is eligible for assisted death. She reveals that each assessment and procedure is billed to the healthcare system, and physicians performing euthanasia may generate substantial income, sometimes over $860,000 annually, raising concerns about financial incentives in what should be a purely ethical healthcare decision. One of the critical issues raised is coercion within MAID. Kelsi shares cases where family members have pressured or even planned MAID deaths for unwilling relatives, sometimes necessitating police intervention. She emphasizes the difficulty in ensuring truly autonomous consent, especially for those with cognitive impairments, mental health conditions, or under family or societal pressure, painting a grim picture of abuses that occur within the program's framework. Kelsi critiques the medical protocols of euthanasia, noting the use of paralytics and sedatives that can cause painful symptoms like pulmonary edema, which victims cannot express due to paralysis. She contrasts this with palliative care approaches, like morphine overdoses, that may offer a gentler, more humane death. Highlighting post-mortem research, she reveals evidence of physical distress during lethal injections and discusses the emotional trauma families experience observing prolonged or failed euthanasia attempts. An important but rarely discussed angle is the link between assisted death and organ donation. Kelsi suggests organs harvested after euthanasia have boosted donation rates, creating additional incentives to prefer specific euthanasia protocols whose drug regimens preserve organ function better than morphine overdoses would. This connection, she argues, raises moral questions about the commodification of death and bodily integrity. The conversation turns to the alarming extension of assisted dying eligibility to non-terminal patients, including those with psychiatric disorders and potentially minors. Kelsi shares data and reports indicating plans and ongoing cases where young people, even children as young as 12, can request MAID if deemed capable of informed consent. She finds this deeply troubling, suggesting that society's acceptance of such expansions reflects a dangerous devaluation of life and a breakdown in parental rights and protections. Kelsi highlights how powerful social and political organizations, some tied to large philanthropic and advocacy groups, are driving the assisted death agenda through advertising and lobbying, often targeting vulnerable groups. She connects these efforts to broader cultural and ideological shifts, comparing top-down pressures to legalize euthanasia with bottom-up movements like transgender activism. Both trends, she believes, reveal how societal control and redefinition of norms are reshaping perceptions of autonomy and identity. A core theme relates to the financial motivations behind assisted death. Kelsi argues that the vast cost savings to governments and healthcare systems by facilitating euthanasia create dangerous incentives to promote killing over care. She notes that many patients facing loss of services or support, whether disabled or elderly, may feel implicitly pushed toward MAID due to a lack of adequate healthcare, social care, or palliative resources. Kelsi bemoans the defunding and marginalization of palliative care and hospice services in favor of euthanasia programs, pointing out that many facilities lose funding if they refuse to participate in MAID. She claims this limits patients' options to a rapid, doctor-administered death rather than compassionate end-of-life care. This narrowing of choice, she contends, undermines autonomy and genuine dignity at life's end. The episode examines Western culture's taboo around death compared to other societies that openly accept and ritualize dying. Kelsi suggests that fear and denial of death fuel demands to control or hasten it artificially. This cultural gap makes the public more susceptible to accepting assisted death as the only compassionate option, reducing space for alternative approaches and deeper reflections on suffering and mortality. Kelsi raises concerns about the psychological toll on physicians who regularly participate in euthanasia, noting there are no mandated mental health check-ins for doctors performing numerous assisted deaths. She compares the lack of psychological debriefing for these doctors to protocols followed by military personnel or police after traumatic events. The normalization of death as a medical procedure, she warns, risks destigmatizing killing and corrupting the medical profession's ethical foundation. Throughout the episode, Kelsi recounts specific tragic cases: a young man with diabetes and depression who obtained MAID without adequate psychiatric evaluation, a woman killed despite revoking her consent mid-procedure and being forcibly held down by family, and veterans offered euthanasia in lieu of treatment. These stories illustrate systemic shortcomings, lax safeguards, and the real human costs behind abstract policy debates. While acknowledging that some terminally ill individuals seek relief through assisted dying, Kelsi firmly draws the line at expanded eligibility categories. She rejects euthanasia for mental illness, minors, or non-terminal disabilities, arguing society should instead invest in better healthcare, psychological support, and alternative therapies like regulated psychedelics for end-of-life care. She stresses that death should never be a first-line healthcare solution, but a last resort grounded in ethical consideration and genuine consent. Kelsi closes by expressing deep concern about the trajectory of assisted dying legislation and societal values, warning that it reflects a sick society prioritizing cost-cutting and convenience over human dignity and care. She urges a reevaluation of how death, suffering, and vulnerability are understood and treated, emphasizing the need for accountability, transparency, and respect for life at all stages.